Memories of the COVID-19 pandemic have resurfaced as a mysterious respiratory illness among children emerged in China, the epicenter of the COVID-19 pandemic. Hospitals in many Chinese cities have been operating at maximum capacity for the last 2 months, taking in more than 9,000 patients a day. The alarming scenes from China have put health authorities worldwide on high alert. There is a new health scare. For months, China has been reporting an increase in respiratory illnesses. This time, it is children who are predominantly affected. Chinese media reports have described crowds of children and anxious parents at hospitals. They show children and even babies wearing oxygen masks, lying on hospital beds. They show crowded waiting rooms and long queues at hospitals. Social media images from China are a heart-rending deja vu with photos of young children connected to intravenous lines receiving fluids in overcrowded hospital waiting rooms. All is not well in China. Having seen up close China's non-transparent behavior during the COVID-19 pandemic, when it stonewalled requests from it for information and credible data, this time the World Health Organization decided to get on the front foot. From mid-October 2023 itself, WHO began monitoring data from Chinese surveillance systems showing increases in respiratory illnesses in children in northern China. And then, when China gave it no information for over a month, on 22nd November, the WHO knocked on China's doors. Citing a report by the Program for Monitoring Emerging Diseases on clusters of undiagnosed pneumonia in children's hospitals, it asked China for information. It asked China for details on the surge of respiratory illnesses. It asked China for lab results. It asked China about the current burden on its healthcare systems. It said it was in touch with clinicians and scientists through its own networks in China. You may note here that much like the time when the COVID-19 outbreak happened, China even this time did not proactively share information with the WHO. So how big is the surge in China? Is it limited to China? And do we really need to worry? We surely need to be on our guard. Infections have proliferated across China's northeastern regions. Beijing and Liaoning, 800 kilometers apart, are the two major hubs. Schools in Beijing are reporting high levels of absenteeism, even dismissing entire classes for at least a week if some students report ill. This report by US-based medical news journal Medscape tells us more. In Beijing, worried parents seeking help for their children are having to wait at least a day, even for emergency care. The Chinese Center for Disease Control and Prevention reported more than 3,500 cases of respiratory infection admitted to Children's Hospital. In Liaoning province, almost 500 miles away from Beijing, there are more reports of sick children overwhelming hospitals. There surely is a surge, and no one is denying that, not even China. So what are Chinese authorities saying? They acknowledge that there is a nationwide increase in the incidence of respiratory diseases, mostly among children. But they blame it on, one, colder weather, and second, China lifting stringent COVID-19 restrictions. They told WHO that this is not the outbreak of a new disease. They attributed the surge in respiratory illnesses to the circulation of known pathogens such as influenza, Mycoplasma pneumoniae, respiratory syncytial virus or RSV, and SARS-CoV-2, the virus that causes COVID-19. So why is this happening in large numbers in China? Experts say children could be affected because of, one, low vaccination coverage, and number two, lack of immunity, as they were largely confined to their homes in the past few years due to COVID-19 restrictions. This eyewitness footage shows an overcrowded waiting area in the Beijing Children's Hospital. Listen to the cries of this mother of a child patient.
My child's test results show positive in both Mycoplasma pneumonia and influenza A. I think her condition is quite complicated. Her dad had been lining up in the hospital for test results. After getting test results, he told me there are still 200 more patients before us.
This report by news agency Reuters says, according to China's Joint Prevention and Control Mechanism of the State Council, the peak is yet to come. It says influenza is likely to reach a nationwide peak during the winter and spring seasons, and Mycoplasma pneumoniae infections will continue to be high in some areas in the near future. China is clearly struggling to contain the spike in cases. But is it conveying the scale of the problem as it stands, or is it playing it down just as it did during the COVID-19 pandemic? China's foreign minister wants us to believe that all is under control.
Recently, you have seen some clusters of flu cases among children in certain parts of China. In fact, that is a very common phenomenon in many countries, and in China, that has been put under effective control.
The WHO is cautious.
There's limited detailed information available to fully characterize the overall risk of these reported cases. However, due to the arrival of the winter season, the increasing trend in respiratory illness is expected. Co-circulation of respiratory viruses may increase the burden on healthcare facilities. According to surveillance data reported to WHO's FluNet and published by the National Influenza Center in China, the level was above usual levels for this time of the year and increasing in the northern provinces.
But what is causing worldwide concern is that cases of fever and lung infection among children are not just limited to China. Simultaneous spikes are being widely reported in a growing number of countries. US and some European countries are affected. Health authorities in the US state of Ohio have reported a spike in cases of pneumonia among children. Health authorities in the US are in touch with their counterparts in China. A clear link between what is happening in China and the United States is though not established. In Europe, Ireland, France, the Netherlands and Denmark have recorded a sharp rise in respiratory illnesses among children. Here too, a clear link is not established. But that may not be the last word on it. While many parts of the world grapple with new waves of respiratory illnesses, experts say it is unlikely that we are seeing the emergence of a novel or new pathogen.
This infection, if it was any novel pathogen which was causing this infection, perhaps it would have been detected because of the preparedness that has been enhanced globally for these respiratory pathogens. But since none of them have reported any novel pathogen, perhaps the likelihood that this would be a new pathogen would be perhaps very low.
But the world is on its guard, having learned its lessons from the COVID-19 pandemic. Nations across Asia have all increased surveillance. India is taking no chances. The Government of India has asked states and union territories to immediately review public health and hospital preparedness measures. India's Health Ministry said, as a matter of abundant caution, it had proactively decided to review the preparedness measures against respiratory illnesses. But there is another cause for concern around what is happening in China. There are concerns that the bacteria, Mycoplasma pneumoniae, one of the common causes of pneumonia, may have developed resistance to antibiotics, even though the infection it causes spreads easily through contact with droplets from the nose and throat of infected people or simply by sneezing and coughing. But there is hope this can be addressed.
There are stray reports of drug-resistant Mycoplasma pneumoniae with the range of antibiotics that are available. Is unlikely to cause any panic or any major public health problem. We need to trust on the health system.
But do you know why is there considerable concern about the spikes in respiratory illnesses in China and beyond its borders? That's because the world does not trust China. The experience of various countries with the COVID-19 pandemic was so bitter that civil society has started raising red flags. In the United States, 5 Republican senators led by Marco Rubio have asked President Joe Biden's administration to ban travel between the United States and China. So what did China do after the COVID-19 pandemic that has led to a trust deficit towards it? Let me take you back in time. 1. China did not inform the WHO immediately after the COVID-19 outbreak. 2. There were mysterious deaths, disappearances and forced escapes of whistleblowers from mainland China. 3. China tried to influence the investigation into the origins of the pandemic by a WHO team of investigators. 4. China played a key role in deciding who the investigators would be. 5. China chose investigators that had a conflict of interest. 6. China never gave unrestricted access to investigators. It never did, despite repeated pleas by the WHO. Even though a new investigation team was formed by the WHO, China never gave it access to original samples, raw data, its laboratories and research institutions operating in the area of the outbreak. 7. China told the world only its version of the truth. It claimed the outbreak happened in the Wuhan Sea market, but said it does not know how it jumped to humans. So WHO experts got no access to original samples to investigate if the virus leaked from a lab accident in a Chinese laboratory. To put it simply, China has a checkered record of suppressing information and, as per some accounts, even destroying evidence linked to the origins of the COVID-19 pandemic. But here is what people in China and around the world need to do: not drop their guard. Keep asking the relevant questions of Chinese authorities, WHO, and the national and local authorities, and practice COVID-appropriate behavior where needed.